Hello and welcome, it's Chris from Christopher Holt Training, and welcome to this week's tutorial where we're going to be talking about what type of low back pain do you have. Now, this isn't going to be a lot of medical terminology or jargon. I'm not going to be using technical words for lower back pain like disc herniation or disc bulge or anything like that. It's going to keep it very simple, very practical and very everyday life, because working with people on a sort of daily basis with lower back pain, they know when their back's hurting and they know when their back's not hurting. So what we can do is identify very practical everyday scenarios where we can find out when the back's hurting and when the back's not hurting, and then from there we can start to identify what we need to do about it and what we need to avoid doing, if that makes sense. So the type of back pain that we're going to be talking about is pain in flexion, so when your spine rounds; pain in extension, so when you're sort of even gone past the upright position; pain when loaded, so if you're for example, when you're walking, which is what we're going to talk about; pain with compression, so when you're holding an object or holding a weight; and then pain a couple of times a year. So we're going to find out which type of back pain that you have, and then we're going to start talking about what you need to start doing and what you need to stop doing. So it just gives you a starting point to start overcoming your lower back pain. Because sometimes we're given all this information about exercises, stretches, everyday things to do, everyday things not to do. We're just going to start off with the simple step one of just start doing this every day and just stop doing this every day, or at least reduce and increase, if that makes sense. But before we get into that, I just want to mention my social media, which you can see up in the top right hand corner. You've got Twitter, Facebook, Instagram and YouTube. So please do come along to any of those, like and follow. If you're watching on YouTube, please subscribe to the video, comment below, ask any questions, anything that you may have learnt, anything you may have found interesting. I'm happy to answer those questions, and it helps me understand how to create better content for you based on those questions that you have. Alternatively, if you want to find out more about my remote lower back pain consultation, where we take this type of information to the next level, and then I can start, in a sense, giving you recommendations and more advice, which is more specific to your lower back pain, I could then set up some sort of remote or online exercise program for you, where you're then able to take your rehabilitation to the next step. So if you want to find out more, just click down in the link which you will find below, and you'll go through to the remote lower back pain consultation page, and then you can inquire from there. So what we are going to do now is go straight through to pain in flexion. So what we've got here, just a quick example in the image there. You can see the lady is sat with a flexed spine, and this is a typical scenario as to when pain in flexion might occur. So as we're talking about pain in spine flexion, and then you've got a real life example, which is slouched or bending posture. So basically when your spine is bent, it feels painful. What could be causing it? Well, it's a high probability it's coming from the disc. So the disc that sits in between the vertebrae, there's a high probability it's coming from there. So what you want to begin doing is learning the neutral spine posture. Also with that, abdominal bracing and the hip hinge. So when it comes to going about everyday life, number one, you need to learn those three techniques, and then you need to apply those techniques into everyday life. Typical things when I'm working with people, these are three of the fundamentals that I have to teach them. So if I'm working in a gym, I have to go through, this is the neutral spine posture, and this is how we maintain it. This is how to brace the abdominals. And this is how we go about hip hinging. Again, as I've mentioned before, during the remote consultation, when I take you through, when I'm giving you the recommendations and the advice, this is the online training that I'm giving you. So I'm not going to throw you in at the deep end. I'm going to drip feed it to you. So these are some exercises to start. These are some things to think about. This is how you do these 3 techniques. What you need to avoid: postures, positions, and loads that flex the spine. So for example, you need to start reducing the amount you're sat with a flexed spine. What you can then do is start reducing the amount that you are sat. If you can get up during the day, that's going to be more advantageous. So we've got postures, positions, and loads. So that could be exercises, that could be when you're moving house, for example, so you're shifting a lot of boxes, or if you're working a more manual job, you're going to be thinking about lifting and moving around objects, but you've got to be doing that in that neutral posture, using the abdominal brace and the hip hinge. Then we come on to pain in spine extension. Now, this is an exaggerated example of spinal extension, but what you might find, you might just be led on the floor with your head tilted up watching the TV, and you might notice there's pain in your lower back, right at the base of your spine. Or you might be led in the gym doing a stretch, and you're pulling your heel towards your bum, stretching your thighs, and you get a pain in the exact same place, so right at the base of your spine. So real life example, so anything where you're bending backwards, those 2 examples that I've given you, the example or the extreme example in the image there, or it might be reaching back to get your seatbelt in your car, as I mentioned there, lying with chest lifted from the floor. That could be doing an exercise, that could be doing a pose in yoga, whatever it might be. So those are some real life examples. You'll know if this is your type of lower back pain. So what could be causing it? So again, it's the disc and possibly facet joint problems. So what the facet joints are, they are basically the joints between the vertebrae. They allow them to slide across each other, so they move in their sort of segmental way. So they don't all just move randomly. So they move as one unit rather than individual units, if that makes sense. So it could be the discs and the facet joints. So what you need to begin doing, much the same as spine flexion, is learn that neutral spine posture, because that's going to hold not only the discs but the facet joints in their most optimal position. The technical term for neutral spine is elastic equilibrium. So it's where all of the stress and the pressure across the vertebrae is distributed evenly or equally around it, rather than if you're in flexion, it sort of targets it to one area of the spine. If you're in extension, again, it targets it to one area of the spine. So you want to start learning that neutral spine posture. As I've mentioned before, this is what I do in the low back pain consultation with my advice and recommendations. And you want to start learning the hip hinge. So again, we are moving the hips rather than the spine. When we lift or move from the spine, we sort of degrade the ability of the spine, and it becomes injured and then painful. If we can move from the hips, they are designed to do that, and that's going to help us keep a healthier spine for longer. And finally, what we need to reduce, again, much the same as spine flexion, is postures, positions and loads that extend the spine. So if you're doing yoga or Pilates or any exercise for that matter, where you're extending the spine, that's something that you want to be avoiding, because if that spinal extension is triggering pain, the more that you do that exercise isn't going to make it better. I know a lot of people tout yoga, Pilates and certain exercises to be good for your back and help overcome lower back pain, but if you have this specific type of lower back pain, it's not going to be advantageous. So it's something that you might want to reduce, and then that extends out into everyday life as well. So you want to start thinking about, when is my spine painful, so i.e. when am I extending my spine, and then can I do that same activity without extending my spine. Back pain number 3 is pain when loaded. So an example of that is walking. Could be walking upstairs, could be walking downstairs, could be walking as this gentleman here over a rough, uneven surface. So anything like that, and then you start to get back pain. So what could be causing it? Well, it's the vertebrae. Well, it could be the vertebrae being compressed. So with the constant sort of loading through the legs, the shock of your foot hitting the floor is going up through your leg into your lower back, where it's vulnerable, and then that constant impact is causing the vertebrae to become painful. So what do you need to begin doing? Well, it's appropriate abdominal bracing. So when we talk about abdominal bracing, we generally mean within exercise. So if we're lifting a heavy load, we need to, in a sense, brace maximally. So we need to pull the muscles in as tight as we can to lift that heavy object. But if we're just walking, we might just need to hold it in lightly. So it's appropriate abdominal bracing. So where we need to learn the abdominal bracing, what we also need to do is abdominally brace appropriately. Also, we're talking about better walking posture. Just by walking in a better posture can spread the stress through the joints more evenly, rather than it being shocked straight up through the legs and then going straight into the spine. And then there could be some other things with regards to exercises and stretches to start doing to help improve that. But for now, we just want to focus on those 2 points. You may find it improves, but then it's then taking it to the next level with the exercises and the stretches. But as I've mentioned at the start and throughout this is just about getting you started. This is not necessarily the whole journey and with the end in mind. It's very much these are the first couple of steps that you can start taking. So things that we might want to reduce is basically higher dynamic loading like running. So if we get pain walking, it doesn't seem or make a great deal of sense to then be running on top of that, because if walking puts 3 times our body weight through the body, then running is only going to be higher than that. And if walking is causing pain, then there's a very good chance that running is going to cause pain as well. Again, we can talk about running posture, so on and so forth, which can help reduce the stress. But for now, just to reduce the lower back pain and give your body a chance to start the healing process, it's a good idea to reduce or eliminate any higher dynamic loading like running. Number 4 is pain with compression. Now, what does pain with compression mean? Well, it's holding an object away from your body. So as you can see in this image down here, you've got the lifting technique. Now, you could see in the first image that the object that he's about to lift, not only has he got a rounded spine, which could be another part of it, it could be the fact that he's lifting with a rounded spine, which would then be pain inflection. But pain with compression, you can see that it's away from his centre of gravity. So his centre of gravity would be somewhere between his heel and the ball of the foot. And as you can see, that box is away from that. Now that's going to put extra pressure and extra load on the lower back, not only with the posture that he's in as well. Then when you move to the picture on the right hand side, so the second picture, where he's now got his spine not only in a better posture, but you can also see the object is now more towards his heel and the ball of his foot. So he's now reduced the lever and he's reducing pressure on his lower back. So that's one example of pain with compression. If you were to then lift that box up to chest height and then go to put it on a shelf, as you start to move your arms away from your body, that again is moving that object, extending the lever away from the center of mass and putting extra pressure on your lower back. So anything where your body, where the object is away from your body, is going to be putting extra pressure on your lower back. So what we want to start doing is keeping the objects closer to us, and rather than moving the arms away from us, move the whole body towards where you want to put it, if that is at all possible. So what could be causing it? Again, vertebra or disc, this time being compressed. So where loading is that dynamic loading over a constant period of time, this is happening potentially in one lift and one sort of pushing away from the body or moving away from the body. So it's slightly different from the loaded. So what do we need to begin doing? As I've mentioned, we need to begin holding objects close to the body, and then, or get help lifting that object if it's a big enough object. If it's a small object like that, we could do it on our own. If it's a much bigger, more awkward object, it's a good idea to get someone to help, because it's that's going to help us reduce the stress on the lower back and help us not have lower back pain as much, if that makes sense. So what do we need to reduce doing? Basically the opposite, is holding object away from our body. So we need to keep the object close and move our body towards where we want it to go, rather than just reaching out in front of us with our arms. And then finally, it's pain a couple of times a year. Now this is a slightly different strategy in how we manage it, but essentially a real life example is painful periods throughout a year, and it reduces after a couple of weeks. So it might be that, as I've put in the image there, it comes in September and it comes in May, for example. Now yours might be more regular or it might be less regular, but you've got to start identifying when that is. So what could be causing it? More often than not, again, it's the discs that are causing the problem, which is then touching on a nerve, for example, and then sending muscles into spasm. And then after a couple of weeks, the disc begins, or the bulge that's in the disc begins to sort of reduce itself. It doesn't touch the nerves calm down, and then the muscles calm down, and then you go, in a sense, out of pain. Now that doesn't mean that the injury is gone, it just means it's receded itself and there's a good chance it will come back. So what do we need to begin doing is, number one, we need to identify pain triggers by keeping a journal. As you can see here, I've just used the example of a calendar, but we might write more detail than that. We might just start by writing, well, I can remember my last one came in January, and then the one after that came in March, and we are now in June. So we're starting to sort of see a pattern throughout our lower back pain. So we need to start keeping a journal. It might be then thinking about, well, okay, so it happens every couple of months. Well, what am I doing every couple of months just before it happens? Then we're starting to identify these pain triggers. So again, we're not thinking in jargon, in technical terms, in anything that's more than just real life and practical everyday things. When I sit with people on a lower back consultation, albeit a remote one or a face-to-face one, these are the questions that I'm asking. What's triggering your pain? What positions are you in? What postures are you in? What loads are you in? How regular is it? So all these different things I'm trying to identify, because it's these practical answers that are pointing me towards not only what your problem is, and then I could put a technical term to it, but it's also pointing me towards how do we begin overcoming it? What do we need to begin doing, and what do we need to avoid doing or reduce doing, as I'm talking you through in this tutorial. So what we need to begin doing is identify pain triggers and keeping a journal, and then we need to reduce the pain triggers. So we need to avoid those pain triggers. So if we can identify them and we can start to see a pattern in our lower back pain, if it's lifting, then we might have a problem in spine flexion, but it's only happening a couple of times a year, so we need to start avoiding that spine flexion. So it could be sitting, lifting, whatever it might be. You will know what is causing your lower back pain. This is one thing that I try to instill in everyone that I see, is that, in a sense, you are the expert in your lower back pain. I am just a toolkit and a degree of expertise that can point you in a right direction, that can start giving you solutions, that can start giving you practical things you can start doing to overcome that. But with regards to what your pain is, you know what that is. You also know to some degree what can help you overcome that pain. You just haven't had the right questions given to you so you can answer them. and you've been told you have this problem, or you've been told you have that problem by certain experts, or you've been told conflicting things by different people and you're completely confused. But what you need to start doing is start identifying what's consistent. Once you can identify what's consistent, then you can start having a proper conversation about what you need to do to start overcoming it. If you go to the right expert who can then start helping you identify where it's coming from, and then the solution, in a sense, begins to write itself if you know the right questions to ask. And that, again, as I've mentioned all the way through this, that's exactly what my remote lower back pain consultation is for. So if you want to find out more about that, go to the link below, click on it, have a little read about it. If you want to then arrange a consultation, then that's absolutely fine. Alternatively, as I mentioned at the start, go to my social media page or pages. Please do like and follow, comment, ask questions, whatever it needs to be, and I will be happy to help. So many thanks for watching. My name is Chris from Christopher Hole Training. I will speak to you in next week's tutorial.